Hello, everybody. This is Monica Heltz, Public Health Director for the Fishers Health Department. Today is December the 8th, and it is a weekly time for our community risk rating metric review. We are still, unfortunately, very much in our red zone for our community risk rating scale, meaning that we have severe risk of community transmission right now. We do see that spread ongoing and increasing. For the month of November, we have more than tripled the number of cases that we had in October. So I want everyone to keep that in mind. We have more than tripled those cases. In October, we had 600 plus cases, and we have seen over 2,100 as of now, and we're still getting reports from November. Our percent positivity rate as a county is at 24.2% for individuals tested. The Fishers Health Department percent positivity is at 12.39% today, which is absolutely the highest it's ever been that I recall. So that puts both of those metrics in our red category. As far as our Fishers Health Department testing site, that's a 60% increase in percent positivity rate over last week. The county rate, I should mention, has also been on the rise, both from an individuals tested and an all tests rate. The all test rate, which is also displayed on the State Department of Health data, is at 13.9%. So I would not be surprised if the county went to red in the next 1 to 2 weeks based on the state's metrics. So just keep that in mind. As far as our case incidence rate is at 94.33. Last week was at 95.48, so not a significant difference. It's down slightly, but I would say that we continue to see increasing cases, and we'll probably see that jump again next week. We are definitely seeing typically more than 100 cases a day. Our public health capacity is our secondary metrics that we tend to look at. Those are doing a little bit better this week. The pre-Thanksgiving testing rush resulted in a decreased availability of testing, which has now resolved. We now have same day or next day testing capabilities or availability of appointments for you if you need them. So that category is in green. Our testing turnaround time remains variable. It has improved since last week. We're looking at 1 to 5 day turnaround time. So I'm going to put that metric in yellow. Because we are getting the lab results back now that they've caught up from that pre-Thanksgiving testing rush. Our tracing capabilities remain strong. Our Fishers Health Department team is working late tonight because we had so many reports today. So they are trying to get everybody notified in less than 24 hours for cases and contacts from receiving those results. So you can expect to hear from them pretty quickly. The State Department of Health made some changes last week that have improved their turnaround times for contact tracing as well. We are doing additional work to support them and make sure that our folks are notified as soon as we're able to notify them based on when we get the report from the state. So I would put the state tracing efforts in our red, but it does seem to be improving. Our hospital capacities continue to decline, and the situation continues to get worse. So we do really worry about needing to support our hospitals and make sure that we really need to start talking about flattening the curve again. We have been talking about it for a while, but that's what we're looking at, is that need to protect our hospital services for essential healthcare provision. Our ICU capacity has gone down. Last week it's at 23%. This week it's at 20%, and we've seen some steady decreasing in those numbers. They bounce around a little bit, but they are trending downward. This is quite dangerous if we don't have any places in the ICU for people that may potentially need those. The number of COVID patients who are hospitalized continues to go up. As of today, it's at 907 COVID patients in District 5. Versus a high in April with 771. So we're exceeding that by quite a lot. And again, I would put that metric in orange, but we are really looking at some strained hospital systems. Just to kind of give you a few other summaries, our age ranges right now for our positive individuals, the highest rates are in our 20 to 29-year-olds. Next highest is in our 40 to 49-year-olds, and the third highest is in our 80 and up age groups. And that really reflects how hard our long-term care facilities have been hit. So please, if you guys can offer your support to our long-term care employees and residents, in a socially distanced way. I'm sure that would be much appreciated. We have also had 565 cases in the past week, 1 death. Indiana is reporting its highest ever number of cases on December 2nd with 8,452. And we are the only state in the country to hit 1,000 cases per 1 million residents. This is not a game we want to be winning. So please, everybody, continue to use your masks, distancing, hand washing. Please engage in essential activities only. Please answer the call for our contact tracers. Be safe. Hold on for just another couple months. We do have good vaccine news on the horizon, but we've got to keep holding on so that we can get through this, and especially to try to get through this holiday season. We are very worried about increased loss to many of our families due to this high rate of community transmission, and what that means for many of our families going forward. And I do not want that to be you and your family. So please be safe out there. Thank you.